Unveiling the Social Determinants of Suicide, a Statistical Exploration. Introduction. Suicide is a critical global health issue, with rates varying significantly across countries. This research explores data from 2000 to 2015 to identify the impact of income inequality, healthcare accessibility, education, and environmental factors on suicide rates. By analyzing these determinants, we aim to guide interventions that promote equitable health outcomes and reduce global disparities. Problem statement. Life expectancy, suicide rates, and the burden of chronic diseases vary widely across countries, often shaped by socioeconomic, educational, and environmental factors. This research investigates how these factors interplay, identifying opportunities to foster targeted interventions for improving public health and achieving greater equity. Social determinants of health. The research emphasizes 4 key social determinants that influence suicide rates and health outcomes. 1. Income inequality. Regions with pronounced income inequality tend to experience higher mental health challenges and suicide rates. 2. Education. Education is a foundational element of health and well-being. Health literacy. Educated individuals make better health decisions and access preventive care. Economic mobility. Education breaks cycles of poverty, reducing health risks. 3. Healthcare accessibility. Access to affordable healthcare is a critical determinant. Barriers to care. Regions with limited facilities report higher mortality rates and mental health issues. Preventive services. Affordable healthcare improves early intervention and treatment outcomes. 4. Environmental and community conditions. Environmental and community factors significantly affect health. Living conditions. Pollution, overcrowding, and poor sanitation increase stress and health risks. Social networks. Communities with strong social support systems experience better mental health outcomes and lower suicide rates. The role of education. Education disrupts cycles of poverty and poor health. Educated parents raise healthier children with better outcomes. Economic stability. Education improves job opportunities, reducing economic stress. Higher education levels empower individuals to navigate healthcare systems effectively. Global health inequalities. Health disparities are particularly stark in lower middle-income countries and rural areas. Challenges in lower middle-income countries. Limited resources and infrastructure exacerbate health challenges. Suicide rates remain high due to economic instability and limited mental health services. Urban vs. Rural disparities. Urban populations benefit from better access to healthcare and healthier living conditions. Rural populations face infrastructure gaps, limited access to clean water, and fewer healthcare facilities. Statistical methods. To uncover insights, the research employs several analytical techniques. Conditional probability evaluates the likelihood of high life expectancy based on GDP thresholds. Bayes' theorem estimates the probability of suicide rates falling within specific ranges based on prior observations. Probability distribution analyzes the frequency of various suicide ranges to identify global trends and outliers. Key findings. The research reveals how these determinants interconnect to shape health outcomes. Economic determinants. Income inequality, strongly linked to mental health issues and suicides. Job insecurity contributes to stress and heightened suicide risk. Educational impacts. Health awareness. Education reduces stigma, encouraging mental health care. Preventive practices. Educated individuals adopt healthier lifestyles. Environmental factors. Poor air and water quality exacerbate physical and mental health issues. Overcrowded living conditions increase stress and reduce overall well-being. Community strength. Social networks act as a buffer against mental health challenges, improving resilience. Recommendations. The research outlines actionable steps for addressing health disparities. Reduce income inequality. Implement policies to promote fair wages and economic stability. Invest in education. Enhance access to quality education, especially in underserved regions. Expand healthcare access. Introduce mobile clinics and telehealth services to reach remote populations. Improve environmental conditions. Invest in clean water, sanitation, and sustainable urban planning. Strengthen community engagement. Support initiatives that foster social cohesion and mental health awareness. Conclusion. Addressing the social determinants of health is essential for reducing suicide rates and improving population well-being. By tackling income inequality, enhancing education, expanding healthcare access, and fostering supportive communities, societies can achieve equitable health outcomes and create a healthier future for all.